Advancements in lung cancer treatment have transformed outcomes, offering new hope for patients.
So, when we talk about the treatment advancements in lung cancer, especially, just few years ago, like a decade or 2 decades back, lung cancer was considered as a single disease, and all stage 4 lung cancer patients were treated similarly with the chemotherapy drug. And the survivals were usually around 6 months to 8 months. It was in the usually in months. But now, with the better understanding of the biology of the disease and greater knowledge about the various molecular subtypes, not only the histological subtypes, but the molecular subtypes of lung cancer, we have several treatment options which have now increased the survival of lung cancer patients to even a decade. Now we can see many lung cancer patients surviving for more than 10 years after their diagnosis of stage 4 lung cancer, in spite of having metastasis spread to the brain also. So this is where the molecular biology of the cancer and the availability of various targeted therapies which target the cancer cells exclusively, and they spare the normal tissues, thereby improving the survivals of the patients, and at the same time preserving the quality of life, or in fact improving the quality of life in these patients. And many of these patients do not require chemotherapy for longer periods of time, thereby we are able to avoid the side effects of chemotherapy. Now, when we look at immunotherapy, previously we used to think that cancer or the cancer tissue is just a ball of tumor cells, but now we understand the tumor microenvironment and why these tumors are escaping the normal immune surveillance. So our the normal immune system in our body has the capacity to identify these cancer cells as foreign cells and fight against them, and this is where immunotherapy plays a role. So immunotherapy stimulates our own body's immune cells, the white blood cells, to fight against the cancer and thereby reduce the disease. And we have seen many instances where with the help of immunotherapy, many stage 4 cancer patients, especially lung cancer patients, have been cured of the disease. So that is how the better understanding of the molecular biology of the cancer, especially more so in the case of lung cancer, has improved the outcomes in these patients.
Precision medicine is transforming cancer care, offering breakthroughs in diagnosis and treatment for improved outcomes.
So, by precision medicine, we have lot of newer technologies that are helpful or being used not only in the diagnostic stage of lung cancer, but also in the treatment and also in assessing the response to treatment and also in the survivals. So, when we look at the diagnostic aspect, so use of the our understanding, or after the human genome project has been completed, we have a complete idea of the whole human genome. And after the completion of this project, we came to know, or there was an increased awareness on the various cancer causing mutations in genes. And our understanding of this background or the basic pathophysiology of cancer has improved or helped us in implementing or using this knowledge to identify the tumors, not only by detecting the mutations, but also by the expression of these mutations as changed proteins, and how this influences the metabolome or the metabolism of the tumors. And with this knowledge, we are able to identify cancers at a very early stage. That is how it is being used in screening cancers. This is more advanced in colon cancer, but in lung cancer also it is catching up. And we have now liquid biopsies, which is a blood-based biopsy. So blood sample is collected from these patients, and the circulating tumor DNA is isolated, and various genomic alterations, mutations in the genes are identified, which will again help us in personalizing the treatment for that particular patient. And also, it can help in generating or identifying or forming new diagnostic tests which will help in identifying these tumors at an early stage, thereby improving the outcomes of these patients and also increasing the survival rates.
Artificial intelligence and robotics are revolutionizing cancer care, offering precision and efficiency in diagnosis and treatment, especially for lung cancer.
Artificial intelligence, I think it has taken over our normal lives, not only for the tech savvy people, but there are huge scopes. There is huge scope for use of artificial intelligence in the treatment of cancers, and especially when we come to lung cancer, it has a role in the diagnostic aspect.